Hi, I'm Carla Heitman, and I'm the office manager for Dr. Ann Lee, El Paso's only microsurgeon offering a specialized breast reconstruction for patients here in El Paso and its surrounding areas. The surgery is called the Diep flap and is considered the gold standard for breast reconstruction. Dr. Lee takes the woman's belly fat and brings it up to the chest wall and creates natural, warm, and soft-looking breasts. We have two of our special ladies here today who have undergone this surgery and would like to share their story with you and help other breast cancer patients be more informed with the choices and choose the option that's best for them.
I was diagnosed with breast cancer this year, March of this year. I was diagnosed with triple negative breast cancer. When I got diagnosed, I was taken back. I didn't know what to think. Your mind just takes over. You feel like you've been given a death sentence. You know that you have a lot of decisions to make at the time. The hardest one is having to tell your family. I got the news, I took in the news, but then you have to turn around and tell your family, and that's what's very hard to do, because you know that you're going to be hurting the people that you love by telling them your diagnosis.
Hello, my name is Rosa, and I was diagnosed in April of 2015. My thoughts when I was diagnosed with breast cancer, I was very devastated. I didn't know what to expect, didn't know what to do. Very emotional time for me.
I happen to be a registered nurse, and where I work, she works. So I knew of her professionally back then. I knew I would see her as a professional surgeon. I didn't know her more than that. I would see her at work and come to work and take care of the patients that she was scheduled to take care of. Then I knew after I got diagnosed, I had options, of course. After I got diagnosed, I'd have options. You know, I decided that the type of cancer that I had, it being an aggressive with a high chance of reoccurrence, I knew I needed to do the double mastectomies. For me, I wanted to do that, but then after that, I didn't know what to do, you know. So I knew of her, I knew of the procedures that she had to offer. So I decided to come see her, and once I did, I realized that she's more than just a professional surgeon. She's a compassionate woman who we are very fortunate here in El Paso to have her here to offer the procedure that she was very careful in explaining to me. The first thing I thought, I want to have the mastectomy, let me have reconstruction, let's go on, and she stopped me. She said, you need to see your oncologist, you need to get informed, you need to see what all your options are, then come back to me, and then we'll take it from there. But you need to get informed as far as your oncologist, what she tells you as well.
Well, I had several surgeries from May of 2015 up until about June of 2016, multiple surgeries. And basically my last option was to do the Diep flap surgery. So I started researching, calling places online, or getting numbers offline and everything. And after calling about 15 to 20 places, I came across Dr. Lee, and very satisfied with her staff and her performance and everything.
Experience with Dr. Lee, like I said, at first was at a professional level, and then once I got diagnosed and I came to see her here, I felt very close to her. She made me feel very comfortable. I feel like she's a highly skilled surgeon. I didn't have any second thoughts in letting her do this procedure, because I know she's had wonderful results. So many people have told me of her wonderful results, and I knew for me, after speaking with her, she gave me that light at the end of my tunnel.
Oh, I've loved Dr. Ann Lee. She's a very compassionate woman. She doesn't really talk to you like on a doctor level. She talks to you like a person-to-person level, you know. And she's very informative. She, you know, explains procedures to you and everything and lets you know what you're going to expect. And pretty much she's right on the money with everything. She knows her stuff. The office staff was great. Haven't ever had a problem with them. They schedule everything right away, and they call you back, see how you're doing after surgeries or to confirm your appointments.
I recommend that anybody that has been diagnosed or has gone through mastectomies to seek her out and see what she has to offer. I'm very fortunate in this position to share that with patients that come in and try to put them at ease, to let them know that yes, it's a big surgery, but the outcomes are great. Very natural outcomes, and I would recommend it highly to anybody in my situation.
I would like to share with all of the females out there that if they're not getting their annual exams, they need to do that and really do your research, because I didn't really know anything about the deep flap surgery until I did my research. The doctor that did the surgery, the mastectomy on me, she had mentioned it to me, and that's when I started doing the research. And just really do your research and talk with the doctor, and you need to be comfortable with that doctor, because if you're not, I don't think you're gonna have a good, outcome.
I would like to give a special thanks to these two very special, brave women for sharing with you. I sincerely hope that you found this segment informative, and also if you or someone you know has newly diagnosed breast cancer or maybe has undergone breast cancer reconstruction, the DIP procedure may still be an option. Please call our office today at 915-351-9000 and schedule a consultation with Dr. Lee. A surgeon's skill, a woman's touch.